All right, let's cut through the noise. There's a massive confusion out there and it could be costing you. I'm David Kurtz with Senior Benefit Services, and today we're tackling one of the most misunderstood topics in senior healthcare, the real differences between Medicare and Medicaid. You've heard the names, right? They sound familiar, but mixing them up can lead to costly mistakes. For our seniors here in Maryland, Pennsylvania, Virginia, and West Virginia, understanding this isn't just important, it's crucial for protecting your health and retirement savings. Let's get straight to it. First, Medicare, this isn't about your income. This is about your contribution. Medicare is a federal health insurance program. You generally qualify by working and paying Medicare taxes for at least 40 quarters, which is 10 years. Most people become eligible at age 65, but listen, it's also available for those under 65 with certain disabilities, or if you have end-stage renal disease or ALS, sometimes called Lou Gehrig's disease. Now, original Medicare has two main components. Part A, your hospital insurance. This is your coverage for inpatient hospital stays, skilled nursing facility care, hospice, and home health care. Now we have Part B of Medicare, which is your medical insurance. This covers doctor's visits, outpatient care, durable medical equipment like wheelchairs, and essential preventive services, including those yearly wellness visits and vaccines. Now, here's a critical point for many of you looking for more. You have options. Beyond original Medicare, there's Medicare Advantage, or called Part C of Medicare. These are private plans approved by Medicare that combine your Part A, Part B, and even include your prescription drug coverage, Part D, most of the time, along with some extra benefits that original Medicare doesn't provide. Our clients in Maryland also find these plans offer excellent value. Choosing the right Medicare plan for seniors can feel overwhelming. Don't guess. We specialize in helping you find the perfect Medicare supplement or Medicare Advantage plan that fits your life. Call Senior Benefit Services today for a free Medicare review. It's a quick call that could save you thousands. Now let's pivot to Medicaid. This is fundamentally different. While Medicare is federal and based on your work history, Medicaid is a joint federal and state program. Its primary purpose? To help people with limited income and resources cover their healthcare costs. Here's the biggest difference. Medicaid has absolutely nothing to do with your age or work history. It's all about your financial situation. And here's where it gets really pretty much state specific. The eligibility rules for Medicaid are different in every single state just about. What qualifies you in Maryland might be different in Virginia or Pennsylvania. Medicaid also covers things that Medicare typically doesn't, like certain nursing home care and personal care services. And unlike Medicare, which is generally for life, you have to continuously re-qualify for Medicaid. If your income or assets change, your eligibility could change too. So let's break down the core distinctions, the vital takeaways for Medicare versus Medicaid. First, Medicare is federal, earned through payroll taxes. Medicaid is a federal-state partnership based on financial need. Second, Medicare is largely for those 65 and older or with specific disabilities tied to your work history. Medicaid, though, is for low-income individuals and families regardless of age. Third, Medicare is typically for life once you qualify. Medicaid, though, requires ongoing requalification based on your income and your assets. Getting these wrong can be a costly mistake. Now, for a common question, can you have both Medicare and Medicaid? The answer is a resounding yes. If you qualify for both, you are what we call dually eligible. This is a powerful combination. When you're dually eligible, Medicare always pays first for covered services. Then Medicaid steps in last, covering costs that Medicare doesn't, like deductibles, coinsurance, and sometimes even your Medicare premiums. Keep in mind that there are basically 4 levels of Medicaid related to the Medicare savings programs. Each level provides different benefits and is based on either individual or joint household income. The easiest way to think of these different levels is that they go from the highest benefits with the lowest income limit to the lowest benefits with the highest income limit. So basically, the less amount of income you receive, the higher the benefits are going to be that you receive from Medicaid. Using this order, the first level is a qualified Medicare beneficiary, also known as QMB. This level provides benefits that pay for Medicare Part A and Part B premiums, covers Medicare deductibles, coinsurance, and copayments. Additionally, beneficiaries cannot typically be billed for services covered by Medicare. The next level is Specified Low-Income Medicare Beneficiary, also known as SLMB, or we call it SLMB. This level provides benefits that pays for Medicare Part B premiums only. The third level down is a qualified individual, also known as QI. This level has limited funding, so it is a first-come, first-served basis. The income levels are higher than the SLMB level, but the benefits are the same. Just like the SLMB benefits, the QI benefits only pays for Medicare Part B premiums. The fourth and last level is Qualified, Disabled, and Working Individuals, also known by the acronym QDWI. This level actually allows the highest level of income to qualify, which equates to about 200% of the federal poverty level. The benefits provided at this level only covers the Medicare Part A premiums for individuals who have lost premium-free Part A of Medicare due to returning to work but are still disabled. If you qualify for one of these levels, then this can dramatically reduce your out-of-pocket healthcare costs. If you live near Cumberland or Frederick or anywhere in our service areas and believe you might be dually eligible, this information you absolutely need to act on. An added bonus? If you're dually eligible, you automatically get extra help with your prescription drug costs through Medicare Part D. This means significant savings on your medications, so don't leave money on the table. Understanding if you qualify for Medicaid and how it integrates with your Medicare is crucial. Our team of Senior Benefit Services can help you decode your options and ensure you're maximizing every benefit you deserve. Visit our website and click on the Contact Us link at the top to schedule your personalized session. At Senior Benefit Services, we don't just explain the rules, we empower you to make the best decisions. We pride ourselves on being professional, caring, and trustworthy, especially when dealing with complex topics like Medicare help for seniors. We break it down into simple terms. Think 5th and 8th grade reading level, not confusing insurance jargon you hear so much out there. Our commitment is to you. We listen, we explain. We help you find the plan that gives you the best value and the peace of mind you deserve. And unlike some, our support doesn't end after enrollment. We're here for you year after year. That's our promise. If you're a senior in Maryland, Pennsylvania, Virginia, or West Virginia, or you're just guiding a loved one through this process, don't delay. Visit us online at www.seniorbenefitclient.com to book your free Medicare review right now, or simply call us right at 800-924-4727 and ask to be connected to one of our knowledgeable advisors. Our experts are ready to answer your questions and guide you every single step of the way. If this video helped you untangle Medicare and Medicaid, be sure to click on that like button. Subscribe to our channel for more insider tips on Medicare and health insurance for seniors. And if you know someone who needs this vital information, please share this video with them. Help them become empowered. Thanks for watching. We're here to help you protect your health and your financial future, and we look forward to hearing from you.